Welcome back to video 52, Staying Healthy During COVID Pandemic. This is Professor Sunil Wimalawansa, I'm Professor of Medicine from New Jersey, United States of America. In this video, we're going to discuss about the importance of remaining calm and engage in meditation and other relaxation methods to overcome stress, thereby reducing the chances of developing complications from COVID. So, COVID-19 epidemic is stressful and affects everyone in every country in the world. Whether the effects relate to social issues, health, economic aspect, in some people it can be severe and going to last for a while. The elderly and those with comorbidities and those who are at high risk areas are particularly affected by the stress that worsen their existing conditions and increasing their vulnerability to contract COVID. For those who are in the front line, such as healthcare workers, law enforcement, and other essential service people, have a higher degree of stress compared to the public. As the duration of the pandemic drags on, these individuals should not let stress accumulate within themselves and thus should practice one or more of stress relieving methods to prevent accumulation of stress, distress, and to lessen tension. The accumulation of stress can make individual irritable and impair their judgment and action. So can make irrational decisions, making the situation worse. This is also particularly important for frontline workers like healthcare workers. Although not common, persistent stress can also lead to depression and or post-traumatic stress disorder. So what is post-traumatic stress disorder? It is not uncommon. So it is a well-studied entity that is caused by one or more of the following: witnessing or experiencing an extreme event, stressful event, or facing situation that lead to sustained stress. There are a large number of courses which I don't have time to go, but please visit any reliable website for more details. Importantly, PTSD switches from the natural physiologic fluctuation of stress hormone like adrenaline and corticoid to a pathological constant release and maintained at a higher abnormal level. That's a fundamental problem associated with PTSD. While intermittent release of stress hormone is essential for human survival, constant elevated stress hormone causes both functional harm and negative structural changes in the brain. This has been very well demonstrated through the functional MRI examination in those affected versus controls. Such a heightened high alert system is not natural and not intended for human beings to have. And this indeed damage caused by this is persistent, sometimes lifelong in some people. It can also have deleterious medical and psychological long-term consequences. This abnormal hormone pattern is one of the root causes of development of PTSD. If you understand properly the basics, one can indeed avoid it developing later. In fact, PTSD can be considered as the abnormal manifestation of endocrine disorder that leads to functional and structural changes in the brain. Such negative plasticity causes restructuring of key areas of the brain. For example, amygdala and hippocampus, among few other areas. Considering the inevitable stress associated with those who are directly affected with COVID-19, there are multiple modalities one could use to achieve the mental flexibility and develop resilience. This including regular participation in relaxation activities such as Tai Chi and yoga, diverting attention from stress conditions to mental chaos to relaxation through music, sports activities, or reading, or engage in other sensible physical activities such as walking, gardening, and indeed daily meditation. So, meditation enriches the mind with clarity. It improves the understanding of the impermanence of life, and developing the ability to accept the reality as it is. Through which meditation improves the ability for the practitioner to better manage their stress. They are armed with now more information and ability, achieving mental and physical relaxation and prevent indeed accumulation of stress and tension. These areas would certainly help not only to reduce stress but also strengthen the immune system. So let's look at briefly how to avoid the future development of depression and PTSD. It's also noteworthy that not everyone exposed to severe stress experience PTSD. There are marked differences in the ability of people to handle acute stress and stressful experiences and coping with stressful situations. Depending on underlying personality and resilience, PTSD can occur in individuals exposed to exceedingly stressful conditions, or those who have encountered seemingly fewer overwhelming stressors. Very minor incidents can lead to stress depending on the personality and underlying characteristic. For example, someone close to or in the distance community having diagnosed with COVID-19 may be